Hello, everyone, and welcome to another exciting edition of Synlab podcast. My name is Uchenna Amadi, and I'll be your host. Today, I will be doing an exclusive with the amazing Dr. Ademola Adewoyin, and we'll be talking on the topic, Know Your Blood, Know Your Health. Do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and Spotify. So before we dive into the questions, I would like to formally introduce our esteemed guest by reading his bio. Please meet Dr. Ademola Adewoyin. Hello, sir. Lovely to have you here.
Hi, it's a pleasure to be here.
Yeah. So it says here that Dr. Ademola Adewoyin is a distinguished Lagos-based physician scientist with specialized expertise in clinical hematology, laboratory medicine, and blood transfusion science. He earned his medical degree from the University of Lagos and brings over 17 years of dedicated clinical and academic experience to the healthcare landscape. 17 years. That's amazing.
Oh, yeah.
So throughout his career, he has demonstrated a profound commitment to advancing health education, particularly in areas of blood health and hematological disorders. His work reflects a unique blend of clinical insight and scientific rigor, making him a respected voice in both medical and public health communities. He's also an active health communicator who leverages social media to promote awareness and provide accurate medical information to the public. Once again, it's nice to have you here, sir.
Thank you for having me.
17 years. How has it been?
Well, you know the life of a doctor.
Getting home by 1 a.m.
Oh, well, I call it the medical streets.
Oh,
I was
wow.
talking to a lady. I said, well, we still the street or medical streets.
Still the streets. Everybody the streets.
Right?
Wow. Once again, like I
Yeah.
said, it's nice to have you here.
Yeah,
I'm
thanks.
looking forward to learning a lot from you. So to our listener, do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and Spotify. Now, starting with this episode, we're going to be talking about understanding blood groups and what's in your blood. So to enlighten our people out there. So I'm going to start by asking, what exactly are blood groups?
Yeah, so thanks for that question. Blood groups, they are antigens
Okay.
that are on the red cells. So if I may explain that, blood is a fluid. It's a tissue in the body. And blood is got two components. There are the cells, or what we call the cellular component, and then there is the non-cellular component, otherwise called plasma. Now, there are different kinds of cells in the blood. There are the cellular components. So you've got the red cells, which is the most abundant.
Yes.
That's actually why our blood is red. So on the surface of these red cells, you have antigens that we describe as blood group. So these are antigens that are peculiar to our individuality. As a matter of fact, in yesteryears, blood groups used to be used for even identification as far as parentage testing or paternity testing is involved. So it used to be one of those metrics we used, before it evolved into HLA. Now we're talking about STR markers and more advanced molecular markers for parentage. That's tracing the root and origin and trying to identify humans based on their evolution and their origin.
Yeah.
So that's what the blood groups are. They are just antigens that are on the blood cells that we use to identify person from person.
Okay, so how do you determine them?
So you would have heard, my blood group is A resource D positive or A positive, as it's often called.
Yes.
We have different types of antigens, these structures on the red cells that characterize. So if somebody is A, it means it's got non-A and non-B.
Okay.
So if somebody is A, if somebody is O, that means the person has got non-A, non-B.
Yes.
If somebody is A, the person has got A antigen. If somebody is B, has got the B antigen, and then you hear something like AB, that means the person has got B, and then the A antigen on their red cells. So the same way we're describing them is the same way we define them. So they are corresponding what we call antibodies that we can direct against these antigens to identify them. And there are a lot of technicalities behind this in the lab. But essentially, we do this by doing a series of bench work to try and check, in terms of forward grouping, to check the antigens on the red cells, and then there are also the
Reverse.
Yes. What we call the antithetical, that we try to check using known cells to identify what is the kind of serum that this person bears. So that we were able to characterize to say, oh yeah, this person is blood group A, or this person is blood group B. And I think I should mention too that there are different kinds of blood group antigens. That word is a big word.
Very big.
In fact, when we say blood group, there are more than 50 described blood group antigens.
Wow.
The commonest is the ABO.
Yes.
So that's the one where you say I'm O, I'm B, I'm A. The next most important is what we call the RH, or the resource,
yes,
in layman terms, or the the commonest of it is the D. So you hear something like I'm O positive, which means I'm O RHD. That's the resource D positive.
Okay.
That's what that means.
Okay.
So that's what the blood groups mean, and then that's how we sort of identify them in the laboratory.
Okay, thank you very much. But how do I put it now? Why is it important for everybody to know their blood group?
It's very important for everyone to know their blood group. One, take for instance, there's an emergency. Life is characterized by emergencies.
Yes.
People have road traffic accidents.
Yes.
Pregnant women want to deliver, they lose a lot of blood, and there are situations that will warrant blood transfusion. In event of blood transfusion, you have to select for blood group. So it's important to know blood group, because in the event of transfusion, especially emergency setting,
yes,
that knowledge of the blood group gives a preemptive knowledge of how to manage that patient in terms of selecting the appropriate blood group for transfusion. So that's one reason why everybody should know their blood group. The other one has to do with pregnancy and childbirth.
Okay.
So a woman is, say, resource negative, say O resource negative or O negative. And then the unborn child has inherited the positive, the resource D positive, maybe
yes,
from the dad.
Yes.
And so the unborn child in there is resource positive. So the mother is going to see that as a threat, because the mother doesn't bear that positive D antigen. And so the mother is going to try to fight, So there are going to be antibodies that will be produced by the mom that would pass the placenta, is going to cross the placenta barrier into the child and begin to damage the child's red cells.
Wow.
And that can lead to death. In fact, that's one of the causes of recurrent intrauterine deaths, when babies just die, especially around the second trimester. So we see that. So it's important to have all this characterization and knowledge of blood group for these purposes.
Okay. So you actually took the RH factor from me, because I was going to ask you to explain, but now you've talked about how it matters in pregnancy and the rest of them. But I want to ask, are there rare blood types apart from the ABO? I know you mentioned that there are over 50. How are they managed in the healthcare system? Can you give a few examples of these rare blood types?
Yeah. So rarity is a question of frequency of occurrence. And the commonest blood group, at least based on data from our population, is the O. That's the ABO blood group. So a lot of us are O. We're just O, ABO, followed by the B, and then followed by A, and followed by AB. So just about 4% of the population is AB. That is not common. But when we say rare, that is really, really, really uncommon. Take, for instance, someone who is AB negative. That person is probably just about 1% of the entire global population. So that is really, really rare. And so you're going to have difficulty in getting blood for such a person, because you will need to check 100 persons before you get one person that is AB negative. So those are examples of rare blood group types. You hear something like Bombay. Bombay blood group.
Yes.
We commonly don't have that in the Nigerian setting, but there are settings like in India where it was discovered in Bombay. That's why it carries that name, Bombay. And those are very, very rare blood groups. There's what we call the RH null phenotype. These are very rare blood groups, and it's probably just barely 50 persons in the entire world that has that RH null phenotype.
That's very rare.
So the person doesn't have anything like RH antigens on their red cell surface. So these are very rare blood groups, and that calls for being on top of your game. Because if you have a patient or someone, a recipient of blood that needs such a blood unit, it's going to be quite tough. So there are mechanisms that we set in place to try and manage this risk. One is that we identify these persons, and that's why we encourage everybody to know their blood group. So take, for instance, you are AB negative. You need to know. And so such persons, you see, we issue like a card to say, look, carry this card. It's a blood group card, so that in the event of an emergency situation, maybe obstetric trying to deliver pregnancy and childbirth, or a road traffic accident, it needs to be known. You know, you will see the driver's license. It's usually one of the things that are registered, that are documented on the, because it's just very important. In the event of an emergency, we need to know that, oh yeah, this person has this blood group, and then the person is bleeding out, and then this is the kind of blood we need to get for this kind of person. Yeah, so it's important to identify these persons and give them a card. The same thing we do for people who have hemophilia, because these are not regular conditions, and people need to know that this condition is there, so that they know how to manage ahead of time. So we give a card to these kind of persons, or they have a band to identify that, oh, this person is a rare breed, and this person needs to be managed this way because of their blood group. The other thing we do is that we have banking for these rare blood groups. You know, so we try to have a reserve, you know, for this kind of blood groups, so that when there's an occasion of need, it's not where we're looking for the blood group. And there are technologies now where you can even freeze red cells. It's just very expensive, but freezing them, you can keep them for much longer, but it's quite expensive, you know. So these are things that can be done to sort of manage this risk for people that have very rare blood groups.
Thank you very much, Dr. Adewoyin. This has been very, very insightful. You know, when you talked about the pregnant woman with the resource fighting the baby because he sees the baby as a threat, that's actually quite enlightening. So to our listeners, stay tuned. We'll be right back with a continuation of this edition. Thank you.